Hello, everyone. Today I'm going to talk to you about the acid-base imbalances, and there are four of them. So let's kind of start with some overview and some general information. Pretty much, we have two organs that work for us or can work against us sometimes for these imbalances. The number one is the lungs. And basically, through hypoventilation or hyperventilation, the body can increase the retention or the excretion of carbon dioxide. The other thing is the kidneys. The kidneys basically reabsorb bicarb, or they can also excrete acid. Now, what's the deal about carbon dioxide and bicarb? Well, carbon dioxide is very acidic to the body. And so, if the lungs are retaining carbon dioxide, you become acidic or you kind of get into this acidic state. Same thing with bicarb, it's very base. So, it's the contrary of carbon dioxide. And when we excrete bicarb a lot, then we basically become very acidic, or if we retain bicarb, then we're very alkaline or base. So write that down and start with that, knowing that carbon dioxide is very acidic and bicarb is very base or alkaline. The next thing that you have to learn and write down is the normal ranges. And so I have them here listed. Pause me if you need to and write them down because you are going to need to memorize them for the rest of your career. So we have a pH that is normal between 7.35 and 7.45, a carbon dioxide between 35 and 45, and a bicarb between 22 and 26. I strongly suggest you find something that is similar to that you can remember these numbers. For example, here's a key or a clue I could give you. The 7.35 to 7.45 is the same 35 and 45 as the carbon dioxide. And then, maybe your birthday falls, between 22 and 26, or you have a significant date or number that you like, your preferred number. Just find something you can relate it to. So now the abnormal conditions that we were going to be talking about is respiratory acidosis, respiratory alkalosis, and metabolic acidosis and alkalosis. We talk about two methods that we can, or the book talks about two methods that you can solve these problems. And one of them is the Rome method. Now, some students like the Rome method, some students like the tic-tac-toe method. It doesn't matter which method you use as long as you get it right. So, Rome method is respiratory is opposite, meaning the pH and the carbon dioxide are in opposite directions. And in metabolic, we have equivalent or equal. They're going in the same directions. If you notice here, my arrows, the pH, if it's going down, your bicarb is going to go down too. So pause me if you need to and write this down. Respiratory always goes in opposite directions, and it's the pH with the carbon dioxide. And metabolic imbalances, they go in the same direction or equal, equivalent, and we're dealing with the bicarb. So let's kind of see how it kind of plays out. Let's just practice so you can see it. So on the first number here, we have a pH of 7.26, I'm sorry. And then is that down or up? That's correct, it's down. It's below 7.35. The next is your carbon dioxide. It's 51. So is it going up or down? It's up. It's higher than 45. And then we look at the bicarb. We look at the bicarb because when we are compensating, and I'm going to talk about compensation a little further, but when we talk about compensation, your other organ will always try to get you to an equilibrium. And so your other organ, in this case, your kidneys, are going to compensate for you. So is my bicarb up or down? It's up. So we know that the pH is down, the carbon dioxide is up, we have opposite, and we know that the body is trying to compensate because we are in a acidotic, respiratory acidotic state. I'm going to basically, the body's saying, I'm going to hold on to bicarb to get you back to normal. So pretty much we have an acidotic state, respiratory issue, and then my bicarb, my kidneys are compensating. Now, yeah, the book talks about fully compensated versus partially compensated. Here I'm trying, since we're introducing it, I'm trying to give you the basics of whether it's compensating or not. Now, for fully compensated, your pH will be normal. And for partially compensated, your pH is still off. So for this example here, we are partially compensated because we know our bicarb is high. The kidneys are trying to work for us, but however, that pH is still off. So it hasn't reached fully compensation yet. So let's try another one. Now we have a pH less than 7.32. So it's down. That tells us it's acidic immediately. We have a bicarb, a carbon dioxide of 45, which is sort of normal. And then we have a bicarb of 15, which is low. It's going down. So as you can tell, my pH and my bicarb are in the equivalent or same direction. So this must be a metabolic acidosis state. Now, we know that our lungs are going to be compensating here. So if we're in an acidotic state and I'm having a metabolic acidosis state, and I know my carbon dioxide is acidic, my body should basically say, wait, hold on. I need to expel carbon dioxide. I keep getting them mixed up. I'm sorry. Carbon dioxide. And so this number, the CO2, should be low, but in this case, it's normal. So immediately right here, we know that the body is not compensating. It's not working for us to go into this equilibrium. Okay, so we have acidosis, metabolic going in the same direction, my arrows. My lungs come in and they're not compensating. They're not doing anything for us to basically expel this carbon dioxide. So let's look into every single imbalance. Respiratory acidosis occurs with hypoventilation, meaning you are retaining carbon dioxide. So we have a pH of less than 7.35 and a CO2 greater than 45. We're retaining CO2. Now, this could occur with many different things, especially respiratory issues like COPD, sedatives, narcotic overdose, pneumonia, atelectasis, maybe pulmonary edema, things where My respirations and my exchange of gases are not working. Now, some of the symptoms or signs are going to be dyspnea, restlessness, anxiety because of the lack of oxygen as well, confusion in this acidotic state, with possible even seizure and coma. How do we treat it? Well, what we need to do is basically expel this CO2, right? Because we're holding on to it. So we need to get rid of it. So we need to increase ventilation. How do we do that? Well, you either treat the cause. So if it's a pneumonia or an overdose, you might have to give them Narcan, or you might have to elevate the head of the bed, or you might have to give them, see if they do um, breathing exercises, pursed lip breathing. Um, so anything that will increase ventilation, anything that will make the patient breathe and exchange that CO2 and expel it out. Now, the compensation here is that our kidneys are saying, whoa, you're in an acidotic state. I need to help you by retaining bicarb. And bicarb is very alkaline, it's very base. So by retaining the bicarb, I am sort of fixing the acidotic state. So when our CO3, HCO3 is high, we know we're compensating. And then if we're fully compensated, my pH is going to be normal. Here's how easy to read, and you can for sure pause the video. Okay, moving on to respiratory alkalosis. This occurs when someone is hyperventilating. Okay, so now we're breathing too fast and we are excreting all this CO2 that is keeping us in balance. So therefore, now we go into an alkalosis state, an alkaline state, because the CO2 is acidic and we're losing it. Now, this can happen because of anxiety, fever, maybe pain, maybe fear, or just improper ventilation mechanisms. Some of the symptoms and signs are dizziness, confusion, headaches. They're kind of similar as the previous ones. Just here, you're going to have that dry mouth because you're breathing really fast. You might have muscle spasms and paresthesia, as well as stomach pain. How do we treat it? Well, we treat it by just taking some slow, deep breath. Let's slow the ventilations. Let's slow the breathing down. You can breathe into a bag, so that way the patient sort of breathes the CO2 back. So they're breathing in, like basically they're breathing the same air that they are expelling out, the CO2. So you can rebreathe that CO2 back. And then treat the cause. If it's fear or anxiety, maybe we need to calm them down, reassure them. If it's pain or fever, we treat those accordingly. The organs compensating here are going to be, again, your kidneys. And in this case, the kidneys are going to say, whoa, you are too alkaline, and I know I have base by my CO3, by bicarb. So I need to get rid of this bicarb so it's not so much alkaline in the body. And so excretion of the bicarb here is what the kidneys do. So when you see it in numbers, you're going to see a pH less than 7.45, a CO2 less than 35. And if they're compensating, you're going to see a CO3 that is less than 22 And if they're fully compensated, your pH will be normal. Here's that easy to read. And we go into metabolic acidosis. Metabolic acidosis is a pH less than 7.35 because we're in an acidotic state. But now we're dealing with metabolic issues. So the kidneys are the ones that we're going to be looking at. And if we follow the Rome method, we know that the CO3 or the bicarb is going to be low as well when you're in metabolic acidosis. Excuse me. Now, different reasons can cause this. It could be an increase of acid because of metabolic processes like DKA in diabetics. We talk about that in the diabetic lecture. Also, starvation or extreme hunger. Or we can lose bicarb, and we have a lot of bicarb in our GI, as well as, of course, the kidneys, right? And so, if we're having diarrhea or if we're having renal issues like failure, we can lose bicarb, putting you or the client in a metabolic acidosis state. Some of the signs and symptoms are headaches, dizziness, confusion, lethargy, but we have this distinct symptom or sign that is the Kussmaul's breathing. They start breathing sort of deep and fast. Okay, now let's think that through. Who compensates here? Yes, the lungs compensate. So if you take some deep and fast breaths, you are expelling that CO2, which is my compensation. So that is why Kussmaul breathing is a sign and symptom of metabolic acidosis because the body's compensating. Haha, right? Interesting. So yes, as I said, the lungs are going to compensate. Your CO2 is going to be low, should be low, below 35 if my body is compensating. I am excreting all this CO2 because we know that CO2 is very acidic. So to treat metabolic acidosis, you treat the cause, whatever is causing it. If it is diabetes, well, let's fix the glucose levels. Then you increase the breaths. Sometimes, occasionally, you might have to give them bicarb to kind of put them, back to normal on that pH. And if it's a renal issue, you give them dialysis. So here's, if you noticed, ketoacidosis, shock, diarrhea, and kidney function. Okay, then let's talk about metabolic alkalosis. We have a pH that is greater than 7.45. And we know that bicarb is going to be high again. So 26, higher than 26 because they're going in the same direction, the arrows. Some of the causes here are things that increase the base, such as ingesting or using too much bicarbonate, like Tums, Alka-Seltzer, things like that. A lot of people, they just get reflux and they just be popping their Tums all the time. Well, that has bicarb in there to neutralize the acid in the stomach, and that could put them in a metabolic alkalosis state. Or you lose acid, and we have a lot of acid in our stomach, okay, in the gastric juices. So we have base in our GI diarrhea stool, but we have acid in our GI contents, like the gastric juices. So vomiting or gastric aspirations are going to be sort of your kind of most common. And then the use of diuretics because we lose acid through our kidneys as well. Some of the signs and symptoms are muscle spasms, tetany, seizures, irritability, dizziness, and then we have a depressed respiratory drive. Again, let's think about this. Now, we're not breathing fast or deep and fast like the Kuzmos. Now we're depressing the respiratory system. That is why, because it's the compensation. We want to hold on to CO2. The body compensates through our lungs by retaining CO2, carbon dioxide, because we're in an alkalosis state, and I know CO2 is acidic, very acidic. So, to treat metabolic alkalosis issues, we treat the cause. So, whether that is, stop vomiting or, maybe cease on the gastric aspiration, or hold on to diuretics. But we also can decrease our breath to kind of go back to normal. So, if this person is fully compensated, you're going to see a normal pH, a CO3 of higher than 26, and then a CO2 of higher than 45. Okay. Here's a little, see that baking soda that I was kind of mentioned to you, like, Thumbs and Alka-Seltzer and whatnot. Then this is like a little chart that I like to give you guys so you can reference to. It does not come from the book, but it's just extra information. Feel free to pause the video and look at it. Okay, well, if you have questions about this, please email me, contact me, and I will surely answer any of your questions. My references are always from our book, and the images are from Google or the book. I'll see you in the next video.